Do you know your GI red flags? These are the most testable ones that you have got to know just by one little phrase. So let's see how many that you know. And these are red flags. So these would be priorities on your exam. Priorities are really big on NCLEX and on exams. All right. Do you know what rigid board-like abdomen means? What does that mean your patient has? This is the biggest GI red flag. If you see this on an exam, pick it. This is peritonitis. So this means that blood, bowel, poop is filling your patient's peritoneal cavity. This is going to lead to massive sepsis and probably septic shock. This is what we call an acute abdomen, which means it needs surgical emergent intervention. All right. Next one, severe abdominal pain and absent bowel sounds. Do you know what that means for your patient? That is a bowel obstruction. This one you have got to know. Abdominal pain and absent bowel sounds is bowel obstruction. Again, this is a surgical or acute abdomen, which means that this is going to need some pretty emergent surgery in order to clear the obstruction. All right, next one, severe right lower quadrant pain plus sudden relief of pain. Now, everybody knows severe right lower quadrant pain is an appendicitis. What does it mean though when all of a sudden they say, oh my God, I was in like 10 out of 10 pain earlier, but now I feel great. Everything's fine. Not fine. Okay, this is not fine. This should be a red flag. As soon as you hear somebody say this, you should be like, oh no, this is a ruptured appy. And a ruptured appendicitis, that means that their appendix has ruptured. And that means that now their peritoneal cavity is filling with poop and blood, and we need to get in there and clean it out. This is another acute or surgical abdomen. All right, next one, cirrhosis and hematemesis. Hema means blood, emesis means to vomit. So if they have cirrhosis and they're all of a sudden vomiting blood, this is a red flag. This is a call a rapid because your patient has ruptured esophageal varices. They will start projectile vomiting blood. They are going to lose blood very quickly and they will end up in hypovolemic shock. You need help with this. This is called a rapid very, very quickly, and we got to get this patient into surgery. All right. Last one, sudden hematochezia. Okay, I like to call it hematochezia because it sounds so much grosser. This is probably one of the grossest words I've ever heard. Okay, so hemat, that means blood. Okay, so this is blood in the poop. This is bright red blood. Now, melena is different. That's black tarry stool. That's an upper GI bleed. Hematochezia is bright red blood coming from a lower GI. This means that they probably have a GI hemorrhage, lower GI hemorrhage. All right. How many of these did you know? Are you able to recognize them on your exam and know that these are your priorities? I have a priority playlist on my page that I'm going to start posting these every day so that way you know big giant priorities for NCLEX and for your exams.